Have you ever stood up after sitting for a while and feel stiffness, pain in your back, hips, or even your neck? If so, you're not alone. There's a reason why that happens. A lot of people think that pain shows up after sitting means they're injured something, but many times it's not an injury at all. It's simply the way your body responds to staying in one position for too long. If we sit for prolonged periods of time, a few things tend to happen. So your hips stay in a shortened position, your glutes become less active, and your posture starts to collapse. Over time, your body's going to adapt to that position. And the longer you stay there, the harder it can be for your body to transition efficiently back into movement. So when you stand up, bend, walk, or try to exercise, your body might compensate. Your lower back might take on extra stress, or your hips can feel stiff. Your neck and shoulders can also tighten as well. Sometimes those movements feel uncomfortable, but not because the movement is bad, just because your body hasn't been prepared for it. This is why I tell my patients that movement isn't usually the problem. Lack of movement is often the problem. Sometimes a few mobility drills, strengthening exercise, and even just breaking up sitting throughout the day can make a huge difference. So if you notice your pain is worse after sitting, do not ignore it. It might be a movement problem more than a pain problem. If you need help figuring out what's driving it, come see us at Dynamic Physical Therapy. We would be happy to help. I'm going to teach you 2 or 3 exercises that we can do to manage this. All you need is a foam roller. So for the first one, you're just going to place the foam roller and just lay in this direction. You want to make sure that it's kind of like halfway through your thoracic spine. You're going to brace your neck, interlacing your fingers, just resting it. Then you're just going to go back as far as you can and come up. That's going to work on thoracic extension. So the opposite movement that you do when you're sitting down. And then you can keep going up, find out different segments, and coming back up and all the way back and up. Just sort of make sure that there's no strain in your neck muscles. You just go up and back. You can do about 10 to 20 reps. And the next one, you lay here, your knees are going to be bent, hook lying position, and just deep breaths hinging from your hips, okay? Engaging and holding it for a few seconds and very slowly coming down one vertebrae at a time. And again, tilting your pelvis back, lifting, hold it. We can always progress it by doing a march, making sure those hips stay level. And to finish off, we can do a hip flexor stretch over here. Make sure that one knee stays on the floor. Elongate your spine and then reach forward, and you should feel a stretch right on the front. We can either hold it for 10 seconds, coming in and out. We can hold it for 30 seconds. And if you want to intensify that stretch a little bit more, you can always bring your heel towards your glute and then